So the first one is true or false. You can have perfect cholesterol and still be at risk for heart disease.
Absolutely true.
Number two, what's one test every adult should ask their doctor about their heart health?
ApoB.
All right, thank you. So the next leading question would be LDL or apolipoprotein B. Which matters more in 2025 for prevention?
ApoB, hands down.
Number four, the biggest misconception about midlife and heart disease. Hey everyone, welcome to another exciting episode on Hormones and Hope. This is Dr. Makhija, and today is my first cardiologist and longevity medicine specialist, Dr. Khadija Siddiqui, with us. So I'm very, very thrilled, excited, and we are going to learn a lot about your health span, about how to live longer, stronger, and we're going to get a lot of tips. So stay tuned for the entire episode. And I would want to welcome Dr. Khadija again. Please tell us what exactly you do, why cardiology, and just share some fun stuff about you.
Awesome. Well, first of all, thank you so much, Dr. Makhija, for having me. Hi, everyone. I'm Khadija Siddiqui, and I am a board certified cardiologist with a focus on preventative cardiology, as well as a very special, deep interest in longevity medicine and precision medicine. So what really drew me to cardiology was going through medical school as we did our different rotations. Cardiology was one of the things that really stuck out because of how complex and amazing the heart is and how it really is at the center of the life force. So going through those rotations, that was the one. There was no doubt this is what I wanted to do. And so I spent the part of my training, the later part of my training, residency, fellowship, went on to become a cardiologist and practicing traditional medicine for over 15 years, taking care of our patients during that time. Really, a lot of what became obvious with our current healthcare, the way it's set up, is that we were focusing so much on just diagnosis and treatment and not enough on prevention. And that's something that I constantly heard from my patients as well. One of the things they would always say is how they don't want to be on more medications, and that's such a common complaint across all our patients. And most of the times, just because of the way our current healthcare system is set up, you see these patients in clinic. Often it's 15-minute visits. And in that time, you have to try and address all these big things. And oftentimes, the only thing you can focus on is, hey, listen, this is the disease that you have, and this is how we're going to treat it. And it doesn't leave much space for everything else. And so, going through one thing I realized is, yeah, all our drugs and new medications are keeping people alive longer, but not necessarily better. And so it was, that right at that point is when I started getting really interested in longevity medicine and focusing more on proactive care. And what became apparent to me is that, medicine has to change. And the new era of our healthcare requires our patients to become more proactive in their own care. They have to stop outsourcing it. They have to take responsibility for it. And we have to start going upstream before disease has taken root, because that's where you can implement change, right? And so the idea is as people are aging, they have to do it powerfully. We have to decrease the period of decline that the majority of elderly patients are left struggling with. And we have to give them this option of extending their peak years so they can perform better, so they can enjoy life more. And, that's it's what I get so passionate and excited about, because with all the advancements that we've already made, this is a possibility. It's real and it's here. We just have to incorporate it into our practices.
Yeah, so amazing. Your passion is reflected in your words and your vibe, so I can feel it, and I'm pretty sure the audience is also gonna is feeling it while you're sharing. So we just had a recent podcast regarding the brain to prevent Alzheimer's and Alzheimer's dementia with Dr. Cabral, and I actually quoted that she's going to talk about a very, very important organ which cannot be replaceable. So that was the brain. I think the second organ is the heart. And it's a key aspect, but I love the fact that you also said that, everything is connected and you are focusing on that preventive aspect because there are so many factors leading to disease, the dis-ease in us. So, I feel like you're one of the pioneers who's getting into this. It's integrating, it's unifying the science as well as the preventive aspect of it, longevity and precision medicine. That's amazing. So, Dr. Siddiqui, we have rapid fire questions for you, and they're geared towards the entire expertise that you're going to share with us today. And a simple yes, no, true, false, or one liner would be great. And then we can do a deep dive learning more about these specific topics. So, you're ready?
Ready? Let's go.
So, the first one is true or false. You can have perfect cholesterol and still be at risk for heart disease.
Absolutely. True.
Number two, what's one test every adult should ask their doctor about their heart health?
ApoB.
All right, thank you. So the next leading question would be LDL or apolipoprotein B. Which matters more in 2025 for prevention?
ApoB. Hands down.
Number four, the biggest misconception about midlife and heart disease.
That you can't have heart disease in midlife, that it's a disease of the elderly. And that's not true. We're seeing younger and younger patients coming in with heart disease now.
Yes, absolutely. Thank you. So, one lifestyle habit that you can name for us that's non negotiable for prevention of heart disease.
Movement, exercise.
Thank you. Oh, I'm loving you. I think we could we could record some videos on exercise because that's what I love to do. Number six, prevent tips and strategies or strategies that you would not want to miss for as an adult if you want to prevent a heart attack. Any three steps strategies?
Sleep is huge. We're recognizing the role of that. I know I have to keep this brief. So, sleep, nutrition, especially with the availability of all these ultra processed foods. So, that is crucial. Stress management. That does not get enough attention. And I would love to elaborate on those.
Absolutely. Yes. We'd love to hear more. So, sleep, nutrition, and stress management. Okay. Number seven, what's one metric that predicts how long and how well someone will live?
VO2 max.
All right. So, you can elaborate on that also. Number eight, what's the biggest myth about aging you wish people knew?
I wish people knew that aging as we know it now is optional. That decline does not have to be a normal part of our aging. And I would love to talk more about that as well.
Yeah, you are going to make us live longer and stronger. Last one, if you could give one prescription for longevity that has nothing to do with medication, what would that be?
Exercise.
Sweet. So exercise wins. We have two answers for exercise. Thank you, Dr. Siddiqui.
Movement truly is medicine, Dr. Makhija.
I take it. Yes, that's the truth. I will absolutely acknowledge that and live by that. Thank you. So now our deep dive question. So wherever you would like to start, you specifically also commented about ApoB. You commented about the exercise part of it twice, and then stress, nutrition, and sleep. Right. So, if I had to be very specific here, because of your specialty as a longevity strategist, how would you address prevention or someone who's seeking longevity because of the family history that they have? How can they approach their health biochemically as well as the preventive steps or strategies that you would recommend?
Okay. So the first thing I would start with, how do they approach this is awareness. And this is one of the things that I feel really this applies to any of our patients, right? Because one of the first things that people need to understand, they have to have an awareness of what's going on. We're not in a time anymore where you just come to your doctor, they tell you what's going on, you get a prescription, and you just go on and implement that. So people need to know what their own risk factors are, their family history. They need to start paying more attention to what their lifestyle looks like, the things that they're putting in their body. What is their environment like? What are the things that are stressing them? And so when I'm saying awareness, that's exactly what I'm talking about, is taking into account all of those things that go into affecting our well-being. And what I want people to understand when we talk about our health, when we talk about our wellness, we're not truly well until we address all the levers of longevity. So, physically, we have to feel well. Cognitively, our brain function has to feel well. Our emotions have to be regulated. So, there has to be emotional wellness. And all of this happens, and our environment has to go, right? So our environment has to be a part of this equation as well. And so, because all of those things that I just mentioned end up affecting an individual, and also metabolic health. And so, all of these things end up affecting an individual really on a cellular level. So, when we're thinking about building a life, right? And you had mentioned health span initially, which I define as the period of time during which we're healthy, we're independent. We're living the life that we want on our terms. So we're not just living longer, we're actually creating a more meaningful life. And so when we're thinking about those things, those are all the things that have to be addressed in order for us to optimize our health. And so that when we show up at our doctor's visits, we also know, well, I've addressed this component and I've addressed this, and this is what is the next thing that needs to, right? And that's it ties down to having taking radical responsibility in your own health journey. And it is time for that. So, so that was the first part. And then the second part, I think you asked for people who have risk factors and what are some of the things that they need to be doing. Do you want to just do this kind of in a later question, or because I know that was a long winded answer?
No, this is good. So you talked about awareness, right? So that's probably happening because, awareness, yes, the internet search, ChatGPT or Claude AI or whatever the Gemini can give us, right? But it may not be accurate or individualized. So when a patient or people are coming to you, they're getting the awareness. Or if you're taking the clinical history, you're deep diving into their story, right? So that's one part of it because you need to have the right medical expert or the right medical resource to gain that awareness. So what's next after that? So say if the patient is ready, psychologically ready, that I really want to prevent, but what do I do now? So what's that next step that they could take once they've realized that I really need to change something in my life? And this is more common, in that midlife, 30 to 50 age group. So what's next for them in your world?
Next is testing. So, once you've done a deep dive into all those different things that we talked about, then you have to do, it's no longer one size fits all, right? So it's not like this is the only treatment we have and this is what we're going to offer. We are in an era where there's constant advancements. And so that's exactly what precision medicine does, is that it factors an individual's lifestyle, their genetic risk, their environmental exposures, all of those things takes it into account so that we can create a customized plan of what this particular individual needs going forward. So what that looks like is getting detailed testing for whatever issues they're affecting, right? Is this someone who is looking healthy on paper, but they're dealing with brain fog, they have fatigue? Is it a woman in midlife who's, has hormone dysregulation? So all of those things you address from the history, and then you go ahead and start doing the testing so that you can create a customized action plan on what this particular person needs going forward.
Got it. So when does testing for VO2 max comes into picture for these individuals, be it men or women?
So VO2 max is something we should all get tested. And the reason for that is VO2 max is such a huge predictor of longevity and your overall health, right? So, what exactly is VO2 max? It's the amount of oxygen consumption during intense exercise, right? So, at peak exercise, how much oxygen you're consuming. And it's a reflection of a person's cardiorespiratory fitness, so their aerobic capacity. And so, when you have someone who has this test on, and the nice thing about VO2 max is that it's something that you can work and improve over time as well. So, this is something that anyone who has an interest in longevity, anyone who's thinking about aging powerfully so that they can do the things depending on what their goals are for themselves. So, someone who's 80 and they want to continue lifting, their VO2 max goal is different than someone who says, hey, I just want to be able to carry my groceries, let's say. And so you train with that end in mind. So it's reverse engineering what you want 2 or 3 decades down. So VO2 max is a big part of that equation. It needs to be tested. There's some basic labs that obviously need to be tested, but more comprehensive than what you would normally get at your doctor's visit. And some of the big ones, I touched on ApoB. That is huge based on an individual person's genetic risk factors. So for my patients who have family members that have had premature coronary artery disease, LP little a, lipoprotein little a, is one of the ones that we also want to test because that has a genetic predisposition. It has nothing to do with lifestyle, nothing to do with environment. So being aware of that when we're checking people for inflammation, because that's such a big cause. And, we didn't really learn much about that in medical school, right? And so these are the things now that and how the impacts that it has. And so now as we're going through and learning about this and understanding what a big part inflammation plays in all of this, checking high sensitivity CRP, that's another biomarker. You're an endocrinologist, so I know we do the hemoglobin A1C, but also your fasting insulin levels. That's another big component that needs to be checked. So there are certain things that assess an individual's metabolic profile. So checking their metabolic profile, checking their inflammation, doing their advanced heart testing, which is the cholesterol panel that I mentioned in addition with the ApoB and the LP little a. If an individual, again, has risk factors, based on their risk profile, is this someone who needs a coronary artery calcium score? Do they need additional testing with the coronary CTA? So all of it is very individualized based on where they are in their life and their lifestyles, and then their risk factors and family history.
Absolutely. So I had a question for you since you're the expert in that because the preventive medicine or the longevity, our mission is the same for our patients and the community. If you can just simplify, or if this is a myth, right, especially that if my coronary CT calcium score is 0 and my LDL is skyrocketing, be it 130s or 160s or 190s, I am okay and I don't need to, do anything in terms of either lifestyle or pharmacological management.
So that's a great question. And the reason this is important is because when we're thinking about our heart health, we can't only think about it in terms of our cholesterol. There is so much data now that tells us that heart health is impacted by more than just cholesterol alone. So, to the first point of what you had said, where you can have someone who has a coronary artery calcium score of 0, but they have elevated lipids, elevated cholesterol. And really, what the coronary artery calcium score tells us is that this individual does not have any calcified plaque. It doesn't tell us anything about non-calcified plaque. So plaque is the component that builds up into our artery walls, and it's what leads to blockages. So if you're, and calcium usually is a big component of those plaques, but you can have plaque without calcium. So if you start feeling reassured because a calcium score is 0, but then your cholesterol level is really high, then it's a disservice to the patient if we don't sit there and tell them, look, you're still at risk for heart disease based on these numbers, but then also hormone dysregulation, metabolic health, stress levels, lack of sleep, how much alcohol they're drinking, right? Because now we say no alcohol whatsoever. It's no longer alcohol in moderation. It's considered a toxic substance, it's a carcinogenic. So, really approaching that individual with that lens of everything being connected in the body and all of it together can affect multiple different organ systems. So, not hanging your hat just on the cholesterol alone, but looking at everything else that can impact their heart health that's beneath the surface that most likely is not being evaluated or addressed.
Yeah, yeah. That was impressive. See, that's why I wanted you to break it down as to how you're actually bringing all these aspects, right? It's not, my patient is not a number. It's not just an imaging test result, but it's so comprehensive that you are truly thinking about their overall health, even though it was described as heart health. But, it corrects so many other aspects of their well being in general. So that was amazing. So, can I ask you for the end of the question? What is your take on, and especially this I encounter in South Asian population on the fear for statin or the fear for any cholesterol medications, while They've been great with their lifestyle interventions. They've been amazing with, how much they could balance out the fat intake. I'm not talking about very, very low fat intake because it's for most of them it's not sustainable. And they've really tried to optimize their body composition, their VO2 max. Where does pharmacological management fit into your world where you're unifying the aspects of prevention as well as prevention of heart attack with medications?
This is another excellent question because what I want people to understand is holistic health can include medications. And, we've had such great advances with medication as well. And that's not to say we throw medicines at everything, but when we have real robust data that shows us that it truly is beneficial, that it changes outcomes, it changes trajectory of a patient's health, then it's something that you can't not recommend. So you have to have these conversations with your patients. And I see this all the time in my practice as well, where, people have this sort of misconception around statins. They're statin averse, as I'll call them, despite all the data. And at the end of the day, all you can do is educate and empower your patients, and ultimately they're the ones that are making the decisions for their health. But I am a believer in medications, essential medications that do affect not just, mortality, but a person's morbidity as well, because it does decrease certain risks. It does help them control those risk factors better. And it is certainly a part of the longevity toolkit. So when we're thinking about all the different things, if all we focus on with the prevention, all we focus on is we're going to do everything except medication, I don't think that that's the most optimal approach.
Absolutely. Yes, I could. I shouldn't be doing that, but I usually do that in my podcast because it's also going to be on YouTube. That, yeah, if I had a drum roll, but that's my table and they'll scarce. So well said. And what our today's era, we have everything around us, not just in the internet world, but there are so many wellness clinics, telemedicine clinics, run without physicians, without actual physician specialists, and they claim themselves as wellness experts or longevity experts, or you take 10 different supplements and you will live longer. And this podcast is also made to bring about that evidence-based discussion where most of the physicians or most of the guests that we've had, they are unifying the concepts of that. Yes, we focus on your lifestyle, your longevity, prevention. What else can you optimize? But at the same time, not forget the science where it can help you in that course of prevention. So that's very, very beautifully explained, and sending you a virtual hug. So thank you, Dr. Siddiqui.
And Dr. Makija, just along those lines, because you did hit a very important point that there are so many wellness influencers out there now who are, talking, their talking points sometimes don't really even, are not something that's supported by science. And this is what I want the viewers and the audience to understand is I get it. I get it. Many people are just so fed up with the Western system. I completely hear you. I see you. And what I notice is those same people, just because they're so fed up, turn away from it and sometimes not to the best of things. So, yes, Western medicine has a place and there are big gaps. Please turn towards people that are still using evidence based solutions, that are looking at the science to fill those gaps, not someone who comes in without having much knowledge and, tout the next big thing right now that's taking off, because that may not be supported by all the data that we have. And so do your research when you're turning towards people, because based on just what you said, everything is so available now. I think the big issue currently is how do you go through all the information and break it down where you can say, okay, well, yeah, this is actually true, this is fact versus this is myth, and it's just out there. So leaning into people that are incorporating evidence-based practice, that are looking at the science, that are still open-minded, but are approaching it from that scientific lens is really the best thing you can do for your health. I mean, that's what I would advise my family members. So I just wanted to throw that out there.
Yes, yes. And you also, in our earlier conversation, you talked about the patient physician shared decision making and how you're giving them the awareness, you're giving them the tools, you're getting the evaluation done, and also letting the final decision rest on them because they are the ones who will be deciding. But, that requires time. That requires, the right expertise and the time which you duly are giving to your patients. And, I really value that as well because that's the story of many of us, like with physicians, where, I don't know how much the people will connect with this, but physicians, many of us went to that stage or phase of burnout where we really wanted to do something beyond medications, prescriptions, and disease management. But it was just how our healthcare system in the United States has been. And many of us have really opted to practice real medicine, which is unifying these two aspects, the evidence based solutions, both in the world of prevention, longevity, as well as the pharmacological options or, evidence based science. So that's impressive what you've created. Yeah, I highly, highly, truly support it. So tell us, Dr. Siddiqui, like, where you reside, where's your practice? How can someone connect with you if they are looking into the longevity aspect of it? They want to see a cardiologist to optimize their health span and get into this understanding of, what preventive tools do I have to not live like my parents or my grandparents were in their 70s and 80s or even early on.
So I'm located in Dallas, Texas, but my longevity practice is remote. So it is available online. And I am on all the social media platforms. So I can be reached through there. So I'm on Instagram and I can share that information with you if you're able to share that later on. But I'm on Instagram, LinkedIn, and Facebook. In fact, a lot of people, and that's where I do a lot of my awareness work as well, because I feel this is one of those things that we need to start educating people about. This is a seed that we have to start planting within their minds because most often people are just going through life and not really thinking about those later decades. But in order for us to thrive during that time, and this is something you and I see frequently is with elderly patients and the level of debility and the loss of independence, the loss of autonomy, loss of sense of self that accompanies those decades of their life, and really just how it impacts them emotionally, mentally, is this is why I am so passionate about this. I've seen it in my own family, and this is something that I refuse to accept. Is one of the things you asked is what do I wish people knew about aging? That the art decline is truly optional, but the work has to start now. And it's possible. We just need to start educating people about it. We need them to understand just how much ownership they can take in their own health, and they get to decide, right? So that's the beauty of it, is that the people that we're helping are the ones that are deciding what they want those decades in their life to look like. And and you mentioned for physicians burnout, right? This is such a big component, and the majority of our healthcare providers are facing this, and so many of them also start struggling with their health problems because there's unmanaged stress. And we work so hard. We spend decades of our lives to get to this point, and then we're just constantly just churning our wheels. And, because the system, the way it's currently set up, is not sustainable. And that by the time it's time for us to say, okay, well, I'm going to retire now, our health has taken a nosedive. Most of us are pretty unhealthy on chronic medications. And so we need to start changing that precedence and be the role models for our patients, for the people that we're leading, because it's so important for us to not only have that awareness for them, but have that awareness in our own lives.
Absolutely. Yeah. Living the talk, right? Yes. So, so, so true. And that's going to, it's going to spread because, I have one of the friends, she's named her practice as My Happy Doctor. And coming from the same story of burnout. And she's like, if your doctor is happy, you'll be happy because I am all with you 100% when you're with me. So, yeah, totally, totally. I support that, that insight that you just gave us. One last question was about muscle and exercise because we had two questions for rapid fire and both of them, merged into basically muscle as our longevity organ. So if you can elaborate on that and give us some tips on how to optimize it.
Absolutely. So when I think about longevity, the way I think about or muscle as a longevity tool, longevity organ is exercise is there's two components to it. So there is, we talked about the VO2 max, which is your cardiorespiratory fitness. So that's something that you have to train. And so cardio workouts are important. But then the second component, especially as we're getting older, is building more muscle, is strength training, because as we're aging, we start losing muscle mass. And muscle is the thing that allows us to prevent falls. It's one of those things where if you're sitting on the floor, you can get up unassisted. So these are things that we tend to just take for granted because it's easy at this point in our lives. But the majority of the elderly patients that come in, they have such little muscle mass. They've become frail. They're more prone to falling. So as we think about exercise, what I want people to think about is there's different components, there's different buckets. So the VO2 max is one, strength training, but also prioritizing flexibility and stability work. Because as we're aging, those are some of the other things that we also lose. So it's not just because VO2 max is down, it's not just because muscle's down, but also as we're losing our stability and flexibility, you're more prone to falls. And as you're older and your bone mass is down, if you fall, you break a hip, and that can start the downward spiral. So, what really simple things to start with is because most of us are so sedentary, we sit around. Each hour, even if you get up for 10 minutes and move, nothing extensive, right? Just movement throughout the day. For someone who's sedentary, start there. For people that are already working out, get your VO2 max checked and then start figuring out what's the target that you want to get to based on where you want to be in your later decades in life. For women, especially, if you're not lifting, you got to start lifting. And so that also, with building muscle, you have to have adequate protein intake. So, it's 1 gram per pound of your ideal body weight. So it's a lot of protein, but start paying attention, because when we start doing things like this is really what's preparing us for what's going to happen to us as we're aging and as we're getting older. And these are the things that'll keep us independent, that'll keep us sharp, that'll keep us strong, that'll improve our quality of life. It'll improve our vitality, our energy, keep us focused, and keep us performing at our best for the remainder of our life. So that really the idea being you've extended this period, your prime years, so that when the decline does happen, it's quick, it's short, rather than this prolonged period of decline that the majority of our patients are currently stuck in.
Yes, yeah. You mentioned 1 gram per pound of protein, right? So usually you'll see the recommendations, zero point 0.8 to 1 gram or zero point 0.8 to 1.2, 1.6 grams per kilograms. So when you look at pounds, it's even more protein that you're focusing on. So I just wanted to emphasize it's very difficult. For me, I'm a vegetarian. I was able to get to 100 grams of proteins per day, as much as possible. Most of the days, I wouldn't say every day. And finally, at age 45, so that's 2025, that I was able to gain 5 pounds of muscle. So Dr. Siddiqui is really pointing on that because, say if you're working out, you're, tearing those muscle fibers in a good way to rebuild that, protein is essential. And if I can do it with the vegetarian diet, and I'd really be very focused on what I was eating and the awareness that you talked about. So why 1 gram per pound?
Because, and I've seen the same data that you're talking about with zero point 0.8 to 1.2, but as we're getting older, it's hard. The goal is to preserve muscle, but also try and build more muscle, because muscle is that longevity organ. And it is, in order for us to build muscle, we have to hit those protein goals. And it is one of the things that in our current lifestyle where ultra processed foods are readily available, it's so hard. It's so hard to find good wholesome nutrition that's going to supplement the body. And this is a reason which we touched on earlier. We're seeing younger patients now because of all the stuff that they're putting in their bodies. So 1 gram per pound is important because what we're trying to do is really make sure that we have enough muscle mass so that as we're getting older, we're still able to perform all those activities that we do now without, because muscle mass is one of those things. Muscle declines quite rapidly once we hit our 50s, 60s. And then even faster from that point on. So the more you have going in, the better shape you're going to be in as you're getting older.
Mhm. Yes. So that's why, I think you're leaving us with, seeing the right specialist and figuring out the nutrition aspect of it and the exercise, physical activity, the sleep, stress management, the emotional health, psychological health, along with the right screenings, the right parameters, that biomarkers that you're looking for. And VO2 max is what you really, really emphasized on. So thank you so much, Dr. Siddiqui. This was very much yes, insightful, but also eye-opening. And you already gave us few steps in terms of strategizing it. I would love to have you again on our podcast, and we could focus on very specific things. I would love to for you to walk us through the biochemical evaluation that you do, and you get in your patients, and how do you take the next steps forward. But until then, thank you. Wish you the best, and I hope we can collaborate again in the future. Thank you so much.
Absolutely. Thank you so much. It was a pleasure being here.
Thank you.